So yes, I want to know what you're doing to help Americans afford health care, and will you sign on to the Medicare for All bill, HR 3069, and if not, why not?
First of all, we all want the same thing. We want everyone to have health care when they need it. Affordable, quality health care when they need it. And so for me, we are working towards the same goal. I believe in universal health care. Everybody should have it. Everybody should have it. Right? And it should be a piece of all of us as Americans that it is a right. Yes. We know that. It's a right of all of us. It's a right of all of us. But let me also say this too. We have health care now. And guess what? Trump and the Republicans are going to try to tear it down. We've been fighting every step of the way to keep pushing, pushing, pushing. We hear stories every day about people who have health care now, didn't have it before the Affordable Care Act. And now there's fear of perhaps losing it again. What we want to do is to continue what we're doing. I love Medicare. I love Medicare. I understand the intricacies of it. It's very good. We know that for a population. If we need to expand it, it's going to take a lot more work. We can do it in a way that we thought we were going to do when we first started doing the Affordable Care Act. You know, doing the public auction, expanding it then, trying to work that through. But right now, Trump and the Republicans, as you know, are going to try to take everything apart. They don't care. They don't care. So the health care that they would want is health care where it might be cheap, but guess what? They won't cover everybody. They want to cover only the healthiest. And as you get older, and believe me, their Medicare would not look like what we expect Medicare to look like. So what I'm saying is that we haven't thrown that out at all. But let's keep things going now so we can push forward to make healthcare better, right? To make it better for the future. So let's keep it going. And we've been fighting inch by inch. I mean, I think Chet knows. Every time something comes up, we have to figure it out. So let's get this part going, because honestly, unless we keep fighting for this, the dream will not be there. We are almost there we would have been for universal health care, almost. But now it's being pulled back. So we have to fight again to keep it going. Because once we keep it going, we'll get to where we all want to get to. Believe me, we will. And I know that's a dream that we all want, to have the health care whenever we need it. Affordable, accessible, where we are.
Answer the question. Yes or no?
You know, I'll tell you something about Medicare for All. I think it's great, but we're doing something now that could ultimately get better than Medicare for All. No?
We never fought for it, no. You have health care. We're struggling. You have privilege.
I don't have privilege, really.
What?
I don't understand what you're saying right now. I don't, but I can't engage you on this because
I've asked your office several times to ask specifically why you don't support Medicare for All. It's one reason why I ran for Congress against you. And you never responded. You never respond. Your health staffer never responds.
I think we have health care now. We're moving toward universal coverage.
Some of us.
Are you on the marketplace? Are you on Southern
It's
California?
stressful. It still costs money. We have to reapply it every year. There's means testing. It's all difficult. We should not be thinking about healthcare right now. You've never had to really think about that, right? We have to. I'm a working class renter. And you're not really answering the questions up here. The questions are curated, you know? Like, this is the first time I've ever gotten to speak to you as someone, as a constituent who has reached out to your office many times for meetings and I get ignored. Your staff is rude. I have tried endlessly.
Excuse me,
Yes.
excuse me, you know,
Let me, as a moderator, interrupt if I may. I'm going to take a little bit of discretion. I'm going to ask you to pose a question, because we did agree to some rules when we started, and give the Congresswoman a chance to answer. And I know that this is not coming out of the box, it's the way we're trying to do it, but I can tell there's a lot of energy around this particular point. So, if you're willing, could you be concise and restate the question, right? And we'll try to get an answer. So I do want to try to get other questions answered as well. All right?
Hi, Congresswoman. My name is Eric Lee. I had filed to run for Congress against you. One of the reasons why is because I could never reach you. And I have been working towards universal health care my entire life. And Medicare for All is a big deal to me. And I've asked Jackie Weinrich in your office to respond to why specifically you don't support Medicare for All. And you don't, and she doesn't respond because my job is to organize advocates that come and speak to members of Congress. That's what I do for work. To share our experiences. I've met with you before after my mom died of colon cancer. I met with you over 10 years ago. We have a picture together online. But for some reason, Medicare for All just escapes you. And I know that Patricia and other people consistently ask you why you don't support Medicare for All. And we just get word salad. But basically, Medicare for All is a North Star that any Democrat can basically run on to get people to come out to vote for them. Because right now, the Democrats aren't giving us anything to vote for. It's all anti-Trump, anti-Trump, anti-Trump. So what are you doing specifically to get voters to come out and vote for Democrats to take back the House?
I think that's a political question you're asking right now. So I think that I've answered the question. We are working for universal health care. Is that what you're talking about now with Medicare for All? We are working in that direction. And you have to all understand right now we're fighting to keep our health care. If you want to give that all up and just say, oh, just do Medicare for All, we have to keep moving forward.
Right.
That's what we're having to do. That's what we're having to do.